doctors say that it will limit, and they will be forced to not do procedures. That's what I heard.
As I understand it, the way that it's being designed is very similar to what the congressman discussed in the beginning. Just like the federal employees plan works for congressmen today and anybody who's ever worked for the federal government, that when you choose a menu, there's a standard benefit option that every insurance plan has to compete against. And they have to at least offer that minimum set of benefits. So it's standard things that most of us that have insurance get in a benefit package. And so they would offer everything that's covered, like major medical, your physician benefits, everything that's there. And so then you choose your benefits from a host of insurance companies. And the design of everything that's on the table of Congress today is based on what federal employees get today, so that you have several private insurance companies to choose from. And as the congressman said, and as you all know, it's controversial whether or not there would be a public plan among those choices. But the private insurance plan, there would be several choices for everyone to choose from. And then you could look as a consumer, based on the prices you want to pay, of which one meets your needs. If you want extra things like vision and dental and things like that, but standard things like hospitalization, going to see your physician, other things that are standard benefits would be covered. And then your private insurer would actually be the one who negotiated with your physician about what was covered. It wouldn't be the government.
And to put it very simply, the effort is to bring insurability or align insurability with the medical practice. And so that's the primary focus there.
Okay. Thank you, Dr. Payne. If you have a pink card, could you line up at the center aisle, please? And while everybody's lining up, we're going to get some blue cards as well. While everybody's lining up, I have one young lady that when I get to the podium, I will go to her for the first question. Once again, please limit your questions and comments to 2 minutes and one question per person, please. Thank you.
Is it Congressman or Senator Scott?
I was a senator once, I was a congressman.
Okay. I've received over the internet a summarization of Obama's health care plan. And I'm very concerned. And I would like to challenge you to please answer me if the things on it are correct. In fact, one statement you just said a minute ago, on page 50, supposedly, it states, all non-U.S. citizens, illegal or not, will be provided with free health care services. On page 59, the federal government will have direct real-time access to all individual bank accounts for electronic funds transfer. On page 195, officers and employees of government health care bureaucracy will have access to all American financial and personal records. On page 268, government regulates rental and purchase of power-driven wheelchairs. On page 425, government provides a approved list of end-of-life resources guiding you in death. On page 430, government will decide what level of treatments you may have at end of life. Congressman Scott, are you aware of these things? You are purporting they don't exist. Are you aware of them?
They don't, but I am aware. They don't exist. They do not exist. Those, what you just mentioned, are untrue. They are false. They are not in the bill. Unfortunately, there are people that are exaggerating and are not telling the truth and want you to believe one thing that is not true so people can be. So I can assure you of that. The whole death bankruptcy, end of life, all of that is not there. What is in the bill on that particular issue is nothing more than what's already in the Medicare fund, which simply says that if a person voluntarily wants to have some counseling from their physician, voluntarily about end of life, then what the bill says is that the government will assist them in providing payment for that if that's what they want. That is their decision, and it's a part of the law. There is nothing there that would do that. And some of those other things, as I mentioned before, about the immigrants, that's not in there. It expressly prohibits anybody from going to the immigrants. On the abortion issue, the Ohio Amendment itself that we passed years ago strictly prohibits any federal funds being used for abortion. All of these issues that are brought up are to try to get off target and to do that. Quite honestly, it's not even fair to the debate. We got an honest and a very serious issue here that we're trying to grapple with and bring down the high cost of health care insurance and make it available for all American people and do it in a way that it is paid for, and then put these consumer protections in so people will not experience some of the horrendous things that you had mentioned. And especially, I am especially concerned about people with disabilities. Ever since I've been in the legislature, we've worked with that to make sure that we're sensitive to that. And you can rest assured that there's nothing in here that would be unfair to any of our American people with any of the things that were pointed out in what you read. For what you read is not in the bill.
I'll be very brief, but we have received the exact same email that you're receiving, and people on our staff have gone through page by page of everything that's needed to go through to make sure none of that is true. So for the folks that say, how can we believe you? We have gone through everything, and things such as the National Health Identification Card. There is nothing in the bill that refers to that. These areas that are talking about this is talking about electronic health records and whether or not this information could be transferred electronically, which we do in the Medicare program today, which saves the Medicare program money to transport things, as we do many things electronically today. So I can show you the page numbers and where these things transfer. No one's going to be transferring money out of your bank account or anything like that without anybody's permission. It's actually designed to protect your privacy, as the Health Insurance Privacy and Portability Act does today. So that is what those provisions refer to, and we have looked at these provisions very carefully.
Some of the strongest provisions in the bill are about consumer protection, to protect your benefits, to protect your relationship with your physician, not to distort it in any way.
I'm sorry, you didn't answer the question. Are those sentences that she read?
I'm sorry, we can't take questions. Yeah, we have people saying,
I think that's important to emphasize. Yes, no, sir, it is not in the bill. That is not reading from the bill. It's reading from something she got. And as a matter of fact, I think my staff, we put up on my own website, I believe, each of those concerns where we have gone point by point and made sure the truth is being told on one point. As I said earlier, there are people that don't want this. And people that don't want this will oftentimes put out untruths to get you off target. But no, this is not in the bill.
okay, we're working on about 12 minutes now, and we still have blue cards remaining. So if you can get right to your questions, we'll have the panelists answer.
I have 2 minutes, correct?
Yeah, 2 minutes.
2 minutes, all right, here, I have my third hand on my watch watching this. All right. All right, this fine lady spoke about the healthcare. The GDP is $12 trillion, and healthcare is 6% of that. How are we wasting $2 trillion? Do the math. Pharmaceutical companies outside this country come to the United States to do their R&D, and then they go back to their countries with the pharmaceuticals that they produce here, that they R&D here, which makes it cheaper for them to sell there. Do you know that? Is that true, or is that not true?
That's your question.
No, it's not true. I have 2 minutes. I'm watching my clock. Thank you very much.